So hey everyone, welcome to Corvet once again. So here we are with the tetracycline. Okay, so if we talk about the tetracycline, so the class of the drug which belongs to the tetracycline, their property is, so the tetracycline are what? A bacteriostatic drug. Okay, these are not bactericidal drug. They are just going to hinder the growth of the bacteria. They aren't going to kill the bacteria, right? They are just the bacteriostatic drug. And how they are going to produce this bacteriostatic effect? They are going to produce this bacteriostatic effect by inhibition of the protein synthesis, right? And these class of the drug are broad spectrum. Okay, these drugs are what? Broad spectrum. They are going to affect both the gram positive and gram negative. In addition to that, they are also effective on the anaerobes and aerobes, right? Okay, I hope this few points are clear that they are bacteriostatic. Okay, how they are bacteriostatic? As they are going to inhibit the protein synthesis, right? I'll discuss that too in the mode of action. Okay, next is they are broad spectrum. They are active against both the gram positive bacteria and gram negative bacteria. Okay, and they are also active against what? The anaerobes and aerobes. Okay, so let's just move with more general information regarding the tetracycline, right? So if we talk about the structure of the tetracycline, so in the structure of the tetracycline there are four rings. Okay, 1 2 3 and 4. So there are four rings in the tetracycline. That's why they are termed as what? Tetracycline, right? So I hope these few points are clear. And these tetracycline are being obtained from what? These are obtained from the soil actinomycetes, right? I hope this is clear. Now moving on to the next point, which is important, that generally majorly of the tetracycline salts, right? Major tetracycline salts, okay, major tetracycline salts are of what? Hydrochloride, right? They are in the form of hydrochloride, which are water soluble, right? But in the case of the doxycycline, which is under the tetracycline, there is what? Doxycycline, which is prepared, the preparation that is coming for the doxycycline is in the form of halide salts, right? So please remember that the all the major preparation of the tetracycline are there in the hydrochloride form of the salt, which is water soluble. And if we talk about the doxycycline, so the doxycycline is available in the halide salt form, right? And we do know that your penicillin G, we had discussed about the penicillin, your penicillin G, right? Which was what? Thermolabile, acid labile, right? And we do have discussed about the aminoglycosides too. And in the aminoglycoside, you could take the example of what? Streptomycin, right? And these are also not prescribed orally, right? I had told you they are generally given through IM route, the intramuscular route, right? But this particular class of the drug, which is the tetracycline, it contraindicate these two. How? The tetracyclines, right? So the tetracycline can be given orally. Okay, I will discuss that particular part in the pharmacokinetics too. Okay, but the tetracycline can be prescribed orally too, right? But the penicillin G, and I had discussed about the aminoglycoside too, that the aminoglycoside can also not be given through the oral route. Okay, because we generally prefer for the aminoglycoside through the intramuscular route, right? And the very first compound that has been discovered as in tetracycline was the chlorotetracycline. Okay, now we will be moving towards the classification, in which first of all we will be discussing about the classification based on the what's the sources, right? Whether it's the natural or the synthetic, right? And next we will be discussing about the on the based of the duration of action, right? So let's just move with the classification. So if we talk about the classification, so it could be divided on the based on the source, it could be divided into two classes, which is the natural. Okay, so first class is your natural, and the second class is your semi-synthetic. So in the natural, first one is the tetracycline, which was the first tetracycline that has been discovered. Okay, it was discovered from the Streptomyces aureofaciens, right? Next is your oxytetracycline, which has been discovered from the Streptomyces ramosus, right? And the last is your demiclocycline, which is also known as the D-methylene chlortetracycline, which has been obtained from a mutant strain of the Streptomyces aureofaciens, right? If we talk about the semi-synthetic compounds, so there are several examples like tetracycline, metacycline, roly-tetracycline, lime-cycline, doxycycline, and the minocycline. These two are quite important from this, right? Doxycycline and the minocycline are quite important, right? Moving on to the based on the duration, right? Because based on the duration is also important, because if the duration is shorter, obviously you have to repeat the drug many times, right? And if the duration of the action of a particular drug is more, means it is long acting, then the dosage and the your frequency of the drug will be going to reduce, right? If we talk about the short acting drug, they can act for a duration of 6 to 10 hours. In the intermediate acting drug, these could act for 12 to 18 hours. In the long acting drug, they can act for 18 to 24 hours. If we talk about the example in the short acting, it's the oxytetracycline, tetracycline, and the chlortetracycline. Okay, these are the three examples in the short acting. In the intermediate acting, it's your demiclocycline, which is a natural, which has been obtained from the natural source, and a metacycline, which is a semi-synthetic version, right? And talking about these three, which is the doxycycline, minocycline, and tigecycline, these three are the long acting, which could act for a longer duration, which is about the 18 to 24 hours, right? And if we talk about the potency of these drugs, the short acting have a low potency, the intermediate have intermediate potency, and the long acting have the highest potency in the class of the drug, which is the tetracycline. Okay, so the doxycycline, minocycline, and the tigecycline, all three have the highest potency. If we talk about the sequential of the potency, so in the case of the long acting, the minocycline is more potent than the doxycycline. Okay, please remember this point, it is important. Okay, now if we talk about the absorption, so the 60 to 80% could be absorbed, the short acting, through the oral route. Okay, absorption is being discussed in the terms of the oral route currently. Okay, and the next intermediate acting, similar, 60 to 80. But the long acting, what's the property of the long acting is, as they are highly lipid soluble, right? So the absorption of the long acting drug is about the 95 to 100%. And one more important property of the long acting is that they are not getting hindered by the food that is present in your stomach. Okay, so there is no interference in the absorption due to the presence of the food in the stomach, right? So this is the important point that you can note down, right? If we talk about the plasma binding affinity, so the oxytetracycline have low and tetracycline have a moderate plasma binding protein affinity, right? If we talk about intermediate, they are having a high affinity towards the protein binding. Okay, and similarly for the long acting, they do have the high plasma binding affinity, right? If we talk about the elimination, so for the short acting, it's the rapid renal excretion. Okay, and in the intermediate acting, there is a partial metabolism of the drugs and there is slow renal excretion. Now what's the important point regarding the long acting is, in the long acting, if we talk about the doxycycline, okay, so the major route of excretion for the doxycycline is not renal or urinary. It is what? It is excreted from the feces, right? Because see, majorly of the antibiotics are generally metabolized in the liver and then excreted through the renal route. Okay, but there are few only which are excreted through the feces, right? So in that few, it's the doxycycline, right? So the primary route of the doxycycline excretion is the feces, okay, as a conjugate, right? And if we talk about the primary route of the minocycline, so first of all, it is going to be metabolized and then it would be excreted in the urine as well as in the bile, right? If we talk about the alteration in the intestinal flora, means when you are giving the drug orally, obviously there are chances that the drug can affect the microbial flora that is there in your GIT tract, right? So if we talk about the what to what extent there is an alteration in the intestinal flora. So if we talk about the short acting drugs, there is a marked alteration in the intestinal flora, means they are going to highly affecting the microflora that is there in your GIT tract, right? Similarly, in the your intermediate acting, the alteration in the intestinal flora is moderate, and there is least in the case of the long acting drugs like the doxy and the minocycline, right? And the if we talk about the incidence of the diarrhea, so there is high incidence in the case of the short acting, right? Intermediate diarrhea has been seen in the case of the your intermediate acting drugs, okay, like demiclocycline, and lowest in the case of the high your long acting. So remember that the major drugs that are long acting, they are quite beneficial, right, in terms of the properties, okay, because they are highly lipid soluble, no interference through the food is there, okay, potency is high, okay, and the intestinal flora is least affected by the your long acting drugs, right? So the importance of the long acting is quite more, right? Now moving towards the phototoxicity, that's the point where the long acting subsides, because there is lowest phototoxicity which is seen in the case of the short acting, highest in the case of the intermediate acting, and the doxycycline do show high phototoxicity. If you have studied about the phototoxicity in the toxicology, let me tell you once also what's the phototoxicity is. See, if this is your blood circulation, okay, blood circulation which is close to your skin, right, which is close to your skin. So in the blood circulation there are certain substances, because the phototoxicity could be there due to the plant toxicity and many more toxicities, right? But the chemical substances or the metabolized drugs do show the phototoxicity. What happened, there are two types of the toxicity that you will phototoxicity that is there in the toxicology you will study, which is the primary and the secondary. So in the primary toxicity, the compound that you had given to the host, okay, that itself going to cause the phototoxicity. But the secondary toxicity has been caused due to the metabolite of the drug that you had given, or the compound that you had given to the host, okay. So the metabolite is the main issue there with the phototoxicity in the secondary phototoxicity. So what's the phototoxicity is? So any chemical substance that is there in your blood circulation which is close to your skin, okay, generally the phototoxicity is experienced in the skin, so there would be irritation, itchiness, okay, that's what the phototoxicity means the chemical substances that is there in the blood circulation which is close to your skin surfaces, right, that lead to the phototoxicity condition. That if I'll be discussing the phototoxicity in the toxicology, I'll discuss that too, right? Now moving towards the specific toxicity, so the oxytetracycline show less tooth discoloration, right? And if we talk about the intermediate acting class of drug of the tetracycline, they do show the diabetes insipidus in some cases, right? If we talk about the doxycycline, it shows low renal toxicity. And what if we talk about the minocycline, so minocycline do show a vestibular toxicity, and less super infection is seen in the case of the minocycline, okay. Now what's there, they are tightly bound and slowly excreted. That's what the property of the long acting tetracycline is, right? If we talk about the potency sequence, so the potency sequence is the minocycline is the most potent, then the doxycycline, then the other tetracyclines, right? So this was all about the classification, right? Moving towards the antibacterial spectrum, I had told you that it is a broad spectrum drug, okay, so it would be acting against both the gram negative and the gram positive, okay, along with the anaerobics and the aerobics. But if we talk about its action isn't against the fungi, virus and the mycobacteria, right? So that's the point you have to remember, that the fungi, viruses and the mycobacteria isn't going to be affected by the tetracyclines, right? And I have told you at this point that aerobic, anaerobic, gram positive and gram negative are going to be affected by the tetracycline, okay, and only Mycobacterium leprae is sensitive to the minocycline, okay, remember this, Okay, if we talk about the spectrum, so what's the spectrum is in the general treatment, for what general treatment we do use the tetracyclines. So if we talk about in the treatment from the mycoplasma, rickettsials, chlamydia, and certain protozoa like Babesia, Theileria, Anaplasma, Coccidia, and Entomelia. When we will discussing about the antipyroplasmic drug or the antiprotozoal drug, we'll discuss the detailed drug analysis there. Okay, so that which drug is more effective against the Babesia, Theileria, Anaplasma, etc. Right? Okay, but there are some strain of the E. coli, Klebsiella, Proteus, Pseudomonas aeruginosa, and Salmonella typhi, which are not inhibited by the tetracycline. Right? So please note that point too. And generally in the field, you are going to experience the cases of the rickettsial, which is the Escherichia canis, okay, in the cases of the dog. So the doxycycline is quite famously used in the treatment of the Escherichia canis in the case of the dogs, right? That point you should remember, because the cases of the Escherichia canis is quite common in the dogs, right? If we talk about the mode of action, so obviously drug is bacteriostatic, but at higher dose it may show the side effects, right? It is clear. Now how it is going to be entering the particular bacteria. So see, either wait a second, either the drug is going to enter through the porin channel, right? Through the porin channel, generally in the gram negatives, right? Okay, through the porin there would be the diffusion, or there would be carrier mediated active transport. Okay, these are the two sources through which the tetracycline can enter the bacterial cell wall. First is the carrier mediated, right? Through the carrier mediated transport. Okay, so the tetracycline is can be gone into the bacterial cell via the two ways, either through the porin channel that is there in the gram negative, right, or through the carrier mediated active transport. Okay, so that's how the tetracycline can enter the bacterial cell, right? Now after entering the bacterial cell, and if we talk about the doxy and the minocycline, they are highly lipid soluble. Okay, doxy and the mino, so they are going to diffuse the drug, they are going to diffuse the cell wall of the bacterial cell quite easily, right, because they are lipid soluble. Okay, so after entering the bacterial cell, what will they gonna do is, so consider this is your mRNA, right? This is your 50s unit, this is your 30s unit, right? 30s unit. Now we all know that there is a tRNA, right? There is a tRNA which will bring the amino acids, right? That will bring the amino acid to this ribosomal complex for the synthesis of the protein, right? Now what happened, this tetracycline is going to bind to the 30s unit, right? When this tetracycline is going to bind to this 30s unit, what will it lead to? There is an acceptor site, right? There is an acceptor site. What this is, what the acceptor site, right? There is an acceptor site there on the mRNA which is going to bind to the anticodons that are there in the mRNA, right? There is codon on the mRNA and there is on anticodon on the tRNA, right? So the anticodons that are there on the tRNA are going to bind on the acceptor region of the mRNA to lead to the synthesis or to the initiate the synthesis of the protein, right? So what the tetracycline do, they do what? They just bind on the 30s unit of the ribosomal complex and just inhibit the attachment of this particular tRNA at the acceptor site. Okay, so the anticodons and the codons are not gonna interact together due to the presence of tetracycline at the 30s unit, right? So the attachment of the tRNA at the acceptor site on the mRNA in the ribosomal complex, it is not gonna happen. Okay, so the attachment is inhibited. So what's the main reason for the inhibition of the protein synthesis? It's the attachment inhibition of tRNA. So that's what's the main purpose or the main reason behind the bacteriostatic effect of the tetracycline, that it won't be allowing the tRNA to just get attached at the acceptor region of the mRNA. So that's what the mode of action of the your tetracycline is, right? I had discussed the majority of the points over here. Okay, So let's move. And so finally the elongation fails, right? If the RNA won't be just getting attached at the acceptor regions, obviously what would it lead to? It will lead to the inhibition of the peptide chain elongation, right? So the peptide chain elongation will lead to be a failure, right? So if we talk about the mechanism of resistance, that how a bacteria can acquire a resistance towards the tetracycline. So the very first is the pumping out the tetracycline. Means consider this is a bacteria, right? Somehow the tetracycline enters the bacteria. So what do the bacteria can perform is, what can a bacteria can perform is that it can pump out the tetracycline. Okay, it can lead to just what? It will just pump out the tetracycline outside the bacterial cell to just have what? To just have a happy life, because the bacteria do want to have an just a stable life, right? Like all of us want, right? So that's why to acquire a resistance towards the tetracycline, what a bacteria can do, it could just pump out the tetracycline out of its cellular structure, right? So that's one way of attaining a mechanism of resistance. Okay, so the next way of attaining a mechanism of resistance, it could be plasmid mediated synthesis of a protective protein around what? Around the ribosomal binding site, which is there on the 30th subunit for the tetracycline, right? And similarly, as the tetracycline is having a 30th subunit attachment, the aminoglycoside do have the attachment at the 30th, right? Remember that point too. Okay, remember that point too. Don't forget and don't confuse where is the attachment site for all the classes of the drug, because it's quite important, because it will be going to asking you. Okay, the examiner will ask you that where is the attachment site of which particular class of drug. So that's an important point you have to consider, right? And there is one more thing, that there is an incomplete cross resistance is seen among the different member of the tetracycline. That's why certain bacteria can be inhibited at a certain attained dose of the doxy and the minocycline. And partial cross resistance has been observed and obtained between the tetracycline and the chloramphenicol, right? Moving towards the pharmacokinetics property. So it's quite important about the tetracycline, the very first point, which is that it is prescribed that what? While you are prescribing the tetracycline, wait a second. While you are prescribing the tetracycline, so you should also tell that you should not take antacids. You should not say take any milk supplements, right? Any milk compound or any milk supplements, right? Any source of calcium ion, any source of magnesium ion, etc. Why? Because these particular compounds that I had mentioned, they have what? They have a tendency to just chelate the tetracycline. If something is going to chelate the particular compound which is destined to just treat a patient, right? If you are giving up a compound to a certain patient, obviously you are aiming that this particular compound is going to treat that particular patient. But if the already the compound that you are giving to the particular patient which is going to be treated, right? If you are giving a compound which you are destined to be treating the animal, right? But you are always giving the tetracycline. If you are giving the tetracycline with what? With the antacids, milk supplements, or the calcium and the magnesium ion supplements, etc., then what will it lead to? It will lead to the chelation of the tetracycline. So if there would be the chelation of the tetracycline, it won't be as effective that you are wanting, right? So the desired result from the tetracycline can't be obtained. That is why it is advised that while you are giving or prescribing the tetracycline, so any sort of milk supplement, any sort of antacids which is containing several salts, right? We do know the antacid contain magnesium, sodium salts, all the salts, right? Or any supplement that is there which is containing the calcium, magnesium salts, right? So you should just say that no, you don't have to give these particular supplements, right? Because ultimately the salts that are there, they are going to lead to what? They are going to lead to the chelation of the tetracycline. So that's an important point that you should note, right? So that's why what I had written over here, that it shouldn't be given with the milk or the milk product that is containing the calcium, magnesium, or the iron preparation. And similarly with the antacids, as they interfere with what? As they interfere with the absorption of the tetracycline in the GIT due to the formation of the chelates, right? With the calcium salts, magnesium salts, iron, and the aluminum salts, right? So it is an important point you should know, because in the exam also they may ask about this particular thing. That's why because in the query they can ask that why tetracycline isn't prescribed with the milk products or milk supplements, right? If we talk about the oral absorption, so oral absorption in the carnivores, it's good, okay, and the peak plasma concentration is obtained between the 2 to 4 hours of giving the drug, and it may persist for the 6 to 8 hours, okay. And generally in the case of the large animal, we mostly prescribe the IM route, okay. IV could also be there, and also the tetracycline is applied topically, okay. If there is in surface lesions, we can apply the tetracycline topically also, okay. And the doxycycline and minocycline don't have an absorption effect, even means the absorption isn't going to be affected even in the presence of the food, right? Due to high lipid solubility that I had told you that in the classification itself, okay. And if we talk about in the ruminants, so the oral absorption in the ruminants, it's poor due to the presence of the microflora in the rumen, okay. So the rumen macroflora will going to just degrade the tetracycline before it reach the blood circulation, okay. So that's why it is very poorly absorbed through the oral route. So that's why we prescribe that the large ruminants should be given, not only the large ruminants, all the ruminants should be given the tetracycline generally through the IM route, or IV route could be prescribed, right? So the IM dosage, if we talk about, gives the peak concentration within the 2 hours, and it may maintain for the 12 to 24 hours. If we talk about the next few points, so the clot tetracycline shouldn't be administered through the IM route as it causes the severe irritation and damage, okay. So that's the point for the clot tetracycline that you should know, remember. And if we talk about the poultry, okay, in the poultry we talk about the how the tetracycline is given. So in the oily preparation, we give the poultry through the subcut route, okay. But not in the cases of the mammal. We do not use the oily preparation in the cases of the mammals, sorry, okay. So we do not use the oily preparation in the cases of the mammals, but we do use the oily preparation in the case of the poultry while we are treating through the tetracycline, okay. So the oily preparation of the tetracycline can be given to the poultry for the treatment, okay. Like there are certain diseases like your blue corn disease in the turkey, right? And there is also what CRD in the poultry, right? So for the treatment of those specific diseases, we can just use tetracycline in the oily preparation through the subcut route, okay. Now moving towards that, the due to the chelation of the calcium that I had told you above also, okay, it get deposited in the bones and the teeth, okay. And the doxy and the minocycline can readily penetrate the tissue and the cerebrospinal fluid. And if we talk about the plasma binding affinity, so for the oxytetracycline it's about 30%, and for the doxycycline it's the 90%, okay. And it undergo the limited metabolism in the domestic animal except the doxycycline, okay. So the limited metabolism is there in the domestic animal except in the case of the doxycycline and minocycline, okay. And doxycycline is an exception. I had told you that it is excreted through the GIT in the form of the feces, right? And tetracycline do excreted in the milk. So that's why there is a certain withdrawal period, okay, in which the milk shouldn't be given, okay, to the owners, to the recipients, right? So the milk shouldn't be given to the recipients until and unless the withdrawal period is completed, right, for that particular drug. If we talk about the clinical usage of the tetracycline, so it could be used for the treatment of the mastitis in the case of the your dairy cattle, right? Not in the just in the dairy cattle, in all the animals. If there is a mastitis case, the tetracycline could be prescribed. And there are two type of preparation that is there, okay. The topical preparation for the tetracycline do come, okay, and it could be given locally or the parent through the parenteral route, okay. And the coliform salmonella enteritis could also be treated through this. The UTI infection, urinary tract infection, could also be treated. The treatment of the bronchopneumonia can be treated with the tetracycline. And for the rickettsias, okay, for the rickettsiosis, we generally use what? Especially chlortetracycline. For the nocardiosis, we especially use minocycline. And for the ehrlichiosis, we use what? The doxycycline, especially. Okay, hemoprotozoans could also be treated. Actinomycosis could be treated. Actinobacillosis can be treated through this particular tetracycline. Pasteurella cases like HS, okay, foul chlorella, which are due to the Pasteurella, could also be treated, right? So in the cases of the poultry, CRD and the blue comb in the turkey, I had told you above that too. So that's could also be treated by the usage of the tetracycline, right? And the situations where the keratoconjunctivitis is there, the tetracycline can be used. Also in the cases of the pyoderma and the psittacosis. Okay, psittacosis is quite common in the parrots, right? In the parrots, it's quite common, psittacosis, right? So moving forward with the adverse effect, which is quite important. Okay, so the adverse effect of the tetracycline is also quite important, right? So it will obviously, if you are going to give, see, if any deviation is made beyond the general guideline which is there for a certain drug, obviously it will lead to the adverse effect. Okay, if I'm saying that the tetracycline should have been given to the ruminants orally, and if you are doing just opposite to that and you are giving the tetracycline orally to the ruminants, it will obviously lead to any disturbance to the ruminal microflora, right? So that's why if you are giving the tetracycline orally, it will lead to what? Ruminal disturbances, right? And will also lead to the decrease in the synthesis of the vitamin B and K, okay, in the cases of the monogastric animal, right? Horses are more susceptible to the oral administration of the tetracycline, right? So the horses should also be given the tetracycline through either the IM or the slow IV route. Means the if you are giving the IV also, so you just take care that you aren't given an IV injection rapidly, right? Why? Because I'll tell you that too in the adverse effect, okay, later, right? And one more thing, that it may lead to the super infections by the fungi, yeast, and resistant bacteria that are there, right? So the main important lesion, it is main that what the tetracycline lead to, it will lead to a brownish discoloration of the teeth and the bone. In the young ones, when we are going to prescribe the tetracycline, we should not prescribe the young ones with the tetracycline. Why? Because the young ones are the growing animals, right? They are just in the phase of the growth, right? So whenever we are giving the tetracycline, so what it may lead to, it may lead to just depositing in the teeth and the bones of the young ones that are growing, right? So if you are going to just give the or prescribing the tetracycline to the young ones that are growing, so it may lead to the deposition of the tetracycline in the bones and the teeth. So initially, what color does the teeth will appear? It will just appear yellowish, okay, and later on the teeth will be going to be just brownish in appearance, right? And the tetracycline do lead to what? The immunosuppression. And if we talk about the chlortetracycline, so chlortetracycline intramammary is not advisable in the dairy cow, okay, as it lead to the severe irritation that I had told you in the pharmacokinetics too, and may lead to the fibrosis of the teats and the udder, right? If we move further, so I had told you about the that you should not give the rapid IV injection. Why? Because it may lead to the hypotension and acute collapse may be there in the cases of the cattle and horses. Why? Because I had told you that tetracycline has a property to just get chelated by the salts of the calcium, magnesium, iron, and aluminum, etc. Okay, as the blood do contain the calcium ion, right? So the calcium ion that is there in the blood circulation may get to just chelate that particular tetracycline that is there in the blood circulation, right? So if the tetracycline that is there in the blood circulation will be just getting chelated by the calcium ion, so obviously it will lead to the condition like hypotension, right? Because the calcium is quite important for just the musculature movement, right? And the blood vessel do have the smooth muscles, right? So it may lead to the condition of the hypertension too. That's why it is advisable to just give the slow IV along with the calcium gluconate, right? Why the calcium gluconate? Because the calcium gluconate do contain the calcium, right? So the calcium disturbance, if there is any calcium disturbance that is there in the blood circulation due to the presence of the tetracycline, it could be counterparted, right? So we can just counterpart that particular calcium which is getting chelated, right? So that's why it is advisable that while you are giving a tetracycline in through the your through the IV route, you should just give it through with the calcium gluconate. It is advisable. Okay, or if the calcium gluconate is not available, just try to just give the IV slowly, not the rapid, right? And it is hepatotoxic in the pregnant animal mainly. Okay, it is hepatotoxic in majority of the animals, but mainly the hepatotoxic effect has been seen in the cases of the pregnant animal, right? And if we talk about that, all the tetracycline are potentially nephrotoxic at higher doses, okay, except the doxycycline, and also they are contraindicated in the renal insufficiency. Means if a patient is there whose report is there with you in which it is stated that this particular patient is having a kidney damage, because you are going to analyze the particular report that you are going to obtain from a diagnostic lab, right? So if you are going to analyze that particular diagnostic lab report, so there may be written that the person is compromised with the kidney or the liver, so you should just prescribe the drug accordingly to that condition, right? Obviously I had told you that too, that the tetracycline class of drug to show the phototoxicity, okay, highest that was with the intermediate acting, right? And the one more important thing is the Fanconi syndrome. Okay, Fanconi syndrome, right? So what's the Fanconi syndrome is? It is a syndrome that is caused by the usage of expired tetracycline. Okay, so when the person use the expired tetracycline products, it may lead to Fanconi syndrome. What happened in the Fanconi syndrome? In this particular syndrome, what happened that it will going to act on the PCT, the proximal convoluted tubule of the kidney, okay, and will lead to the damage of that particular part. So what it will lead to? It will lead to the amino aciduria. Means there would be the amino acid that will be there in the urine, right? Glycosuria would be there. The glucose presence would be there in the urea, right? Condition like pyuria and polydipsia would be there, right? So that's why you should consider that if the tetracycline product that is there in your clinics, if it is expired, so just throw it away, because it shouldn't be administered to the patient, because it may lead to the Fanconi syndrome. It's quite a famous question too. Okay, so which class of drugs do show the Fanconi syndrome? Okay, so Fanconi syndrome, it's quite important for the objective point of view. Okay, so just remember this particular syndrome. It's quite important that which class of drug to show the Fanconi syndrome. So the answer is the tetracycline, right? And if we talk about that demeclocycline, it induces diuresis. Diuresis means excessive production of the urine, right? By what? By showing the antagonistic effect for the antidiuretic hormone. Okay, so it do what? It will be going to just block the antidiuretic receptor. Okay, antidiuretic hormone receptor. It is going to block just that particular receptor, and also used for the treatment of the hyponatremia, right? If we talk about the precautions that you should take while giving a patient tetracycline, first of all, the main is that you should prescribe the particular tetracycline by mentioning that you should not take the milk products, right? Any sort of antacid shouldn't be taken while you are taking the medicine, because it will lead to the chelation. Okay, it will lead to the chelation of the particular tetracycline, and that particular tetracycline won't be effective. That's the main point that you should consider. Okay, and the tetracycline shouldn't be mixed with the penicillin too. Okay, you cannot mix the penicillin along with the tetracycline. Okay, remember this part. Okay, and should not be prescribed to the pregnant animal or the lactating animal or to the young ones. Okay, and it is also not given the animal which is having the impaired liver or kidney, because we know to some extent the tetracycline is nephrotoxic as well as it is liver toxic, means the hepatotoxic, right? So I hope this particular part of the tetracycline is clear to you. So thank you everyone, have a nice day.